Hi, I am Dr. Leena Jain, Plastic and Reconstructive Surgeon at Mumbai, and you are currently at Plasticos Clinic. Today we are going to talk about bladder reconstructive surgeries for adynamic bladders. Now, adynamic bladders are bladders which by birth or development or by any form of spinal cord injury which causes the detrusor muscle to be inactive. That means the patient has a bladder, the bladder is filling up with urine, but the patient is not able to evacuate the bladder because he is not able to contract the innermost muscle of the bladder, so the bladder does not empty itself. In these conditions, patient has to use a catheter and do self-voiding. So this condition is called adynamic bladder. Now, adynamic bladder is a potentially treatable condition. This happens, like I said, because of congenital problems or because of developmental issues or following accidents or any kind of surgery for tumors or for trauma, wherein the spinal cord nerves supplying these muscles of the bladder get damaged. These patients need a thorough evaluation to first diagnose that it is an adynamic bladder or something called detrusor instability or inactive detrusor muscle. So by ultrasound and uroflowmetry, we assess whether the detrusor muscle is able to contract or not contract. We also do nerve conduction studies and come to the diagnosis. And then we do an ultrasound or a Doppler to see how we can augment this muscle or how we can make this muscle functional. So the essential part of the surgery is to substitute action of the detrusor muscle. And how do we do that? We use a muscle from elsewhere from the body and wrap the bladder with this new muscle. This new muscle is a functioning skeletal muscle. Every time this muscle contracts, the bladder is going to get squeezed or compressed and the patient will be able to pass urine and the patient will be able to remove or stop using his catheter. Now, this muscle can be taken from the abdomen itself, which is the rectus abdominis muscle. We use that muscle, we mobilize, take it around the bladder and hitch it, keeping its nerve supply and blood supply intact so that every time the patient contracts his abdomen or the muscle is contracting, the bladder gets compressed and urine comes out. The other muscle that we can use is a muscle from the back. It's a long, broad muscle called the latissimus dorsi. This muscle, we disconnect it from the back with its nerve supply and blood supply. We open the abdomen, we identify the bladder, we wrap this muscle all around the bladder. We hitch up the blood vessels to blood vessels adjacent in that area and the nerve to the nerves of the rectus abdominis muscle so that it gets a nerve supply, it gets a blood supply. When these two things are done, this is a living and a functional muscle. Every time this muscle contracts, the bladder will get compressed and the urine will come out. So this is called detrusor myoplasty or surgery for adynamic bladder or bladder reconstructive surgery.